Hey all, welcome to your lesson on 8.1 and 8.2 on Intro to Psychological Disorders. So we're going to start off with talking about what's the line between normality and abnormality. Who in the rainbow can draw the line where the violet tint ends and the orange tint begins? Distinctly, we see the difference of the colors, but where exactly does the first one blendingly enter into the other? So with sanity and insanity. What is a psychological disorder? It's a syndrome marked by a clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior. Significantly disturbed thoughts, emotions, or behaviors are dysfunctional or maladaptive. They interfere with normal day-to-day life. For instance, believing your home must be thoroughly cleaned every weekend is not a disorder. But if cleaning rituals interfere with work and leisure, they may be signs of a disorder. Can the definition of significant disturbance change over time? From 1952 through December 9, 1973, homosexuality was classified as a psychological disorder. As of December 10, 1973, it was not. The American Psychiatric Association made this change because more and more of its members no longer viewed same-sex attraction as a psychological problem. However, the stigma and stresses that people who are gay, lesbian, transgender, and gender nonconforming often experience can increase the risk of mental health problems. What was trephining? In the Stone Age, drilling skull holes like these may have been an attempt to release evil spirits and cure those with mental disorders. Eek! How was mental illness treated during the Middle Ages? Well, mental illness was believed to have been induced by the devil and required a harsh cure that would drive out the evil demon. People considered mad were sometimes caged or even given therapies such as genital mutilation, beatings, removal of teeth or lengths of intestines, or transfusions of animal blood. What were some efforts at reform at the turn of the 19th century? Reformers such as Philippe Pinel in France opposed brutal treatments, and under his influence, hospitals sponsored patient dances called lunatic balls, as depicted in this painting by George Bellows, called Dance in a Madhouse. What's the medical model? So, switching gears in the lesson, this is the concept that diseases, in this case, psychological disorders, have physical causes that can be diagnosed, treated, and in most cases cured, often through treatment in a hospital. By the 1800s, researchers discovered that syphilis infects the brain and distorts the mind. Researchers began to look for physical causes of other mental disorders and for treatments that would cure them. Hospitals replaced asylums, and the medical model of mental disorders was born. What is the biopsychosocial approach to understanding mental illness? The biological, psychological, and social cultural influences together weave the fabric of our behaviors, our thoughts, and our feelings. We've been saying that all year long in psych. As individuals, we differ in the amount of stress we experience and in the ways we cope with stressors. Cultures also differ in their sources of stress and in their traditional ways of coping. Today's psychology studies how biological, psychological, and social cultural factors interact to produce specific psychological disorders. What is the vulnerability, stress, or diathesis stress model? The biopsychosocial approach gave rise to the stress vulnerability model, also called the diathesis stress model. This model suggests that genetic predispositions combine with environmental stressors to increase or decrease the likelihood of developing a psychological disorder. What is epigenetics? This is the study of environmental influence on gene expression that occur without a DNA change. Research on epigenetics, literally in addition to genetic, supports the vulnerability stress model by showing how our DNA and our environment interact. In one environment, a gene will be expressed, but in another, it may lie dormant. For some, that will be the difference between developing a disorder or not developing it. Why do clinicians classify psychological disorders? In biology, classification creates order. To classify an animal as a mammal says a great deal, that it is warm-blooded, has hair or fur, produces milk to nourish its young. In psychiatry and psychology, too, classification orders and describes symptoms. For instance, to classify a person's disorder as schizophrenia suggests that the person talks incoherently, has bizarre beliefs, shows either little emotion or inappropriate emotion, or is socially withdrawn. What beyond describing symptoms is the purpose of diagnosing disorders? But diagnostic classification gives more than a thumbnail sketch of a person's disordered behavior, thoughts, or feelings. In psychiatry and psychology, classification also aims to predict a disorder's future course, suggest appropriate treatment, and prompt research into its causes. To study a disorder, we must first name and describe it. What is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition? The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is what we're going to refer to from now on as the DSM-5, is a widely used system for classifying psychological disorders. Mental health professionals use the detailed diagnostic criteria in the DSM-5 to guide diagnosis and treatment. What are some changes to diagnostic labels in the 5th edition of the DSM? The conditions formerly called autism and Asperger's syndrome were combined under the label autism spectrum disorder. Mental retardation became intellectual disability, and new disorders such as hoarding disorder and binge eating disorder were also added. Are some diagnoses controversial? Well, yes. For instance, disruptive mood dysregulation disorder is a new DSM-5 diagnosis for children who exhibit persistent irritability and frequent episodes of behavior outbursts 3 or more times a week for more than a year. Will this diagnosis assist parents who struggle with unstable children, or will it turn temper tantrums into a mental disorder and lead to over-medication, as the chair of the previous DSM edition warned? What's one criticism of the DSM-5? Critics have long faulted the DSM for casting too wide a net and bringing almost any kind of behavior within the compass of psychiatry. Some psychologists believe the DSM-5's even wider net will extend the pathologizing of everyday life. Another concern critics of the DSM-5 raise is the overlabeling of what might be common everyday feelings and practical responses to traumatic events. For example, the DSM also now classifies severe grief following the death of a loved one as a possible depressive disorder. Critics suggest that grief could instead simply be a normal reaction to tragic events. What's a benefit of labeling disorders with the DSM-5? For those who experience these challenging symptoms, diagnosis and treatment can be a relief and bring improved functioning. In psychiatry and psychology, classification also aims to predict a disorder's future course, suggest appropriate treatment, and prompt research into its causes. To study a disorder, we must first name and describe it. How can diagnostic labels be misleading? Once labeling a person, we view that person as different. Labels can change reality by putting us on alert for evidence that confirms our view. And in a classic study, teachers who were told certain students were gifted then acted in ways that elicited the behaviors they expected. Labels can be self-fulfilling. What research has been conducted on mislabeling of behaviors? David Rosenhan and 7 of his graduate students went to hospital admissions offices complaining falsely of hearing voices saying empty, hollow, and thud. Apart from this complaint, and giving false names and occupations, they answered questions truthfully. All 8 healthy people were misdiagnosed with disorders. How did being labeled as ill impact how others viewed the grad students? Until being released an average of 19 days later, those 8 patients showed no other symptoms. Yet after analyzing their quite normal life histories, clinicians were able to discover the causes of their disorders, such as having mixed emotions about a parent. Even routine note-taking behavior was misinterpreted as a symptom. How do labels have power in everyday life? Getting a job or finding a place to rent can be a challenge for people recently released from a psychiatric hospital. Label someone as mentally ill and people may fear them as potentially violent. That reaction may fade as people better understand that many psychological disorders involve diseases of the brain, not failures of character. Speaking out. Public figures have helped foster understanding by speaking openly about their own struggles with disorders such as depression and substance abuse. During his campaign, Boston Mayor Martin Walsh spoke openly about his past struggles with alcohol. His story of recovery helped him win in the 2014, the closest Boston mayoral election in decades. Mental illness in Hollywood. Old stereotypes are slowly being replaced in media portrayals of psychological disorders. Recent films offer fairly realistic depictions. Iron Man 3 portrayed a main character, shown at right, with PTSD, post-traumatic stress disorder. All right, so moving into another part of our lesson, how has broadening the diagnostic criteria of ADHD created a controversy? For example, the DSM has broadened the diagnostic criteria for attention deficit hyperactivity disorder, otherwise known as ADHD. For those who experience these challenging symptoms, diagnosis and treatment can be a relief and bring improved functioning. However, critics suggest that the criteria are now too broad and may turn normal, childish rambunctiousness actually into a disorder. How frequently is ADHS, so hyperactivity disorder, diagnosed? Should be ADHD. Twice as often in boys as in girls, 11% in 4 to 17-year-olds, and 2.5% in adults. What are the symptoms of ADHD? Inattention and distractibility, hyperactivity, and impulsivity. What are the arguments regarding the diagnosis of ADHD? Children are not meant to sit inside for hours in chairs. The youngest children in a class tend to be more fidgety and often more diagnosed. Older students may seek out stimulant ADHD prescription drugs, good grade pills, meaning they help you focus and get good grades. And they really don't. That's not a healthy thing to do. What are the long-term effects of drug treatment and why the increased diagnosis worldwide? So what do supporters of ADHD diagnoses note? More diagnoses reflect increased awareness. ADHD is a real neurobiological disorder whose existence should no longer be debated. ADHD is associated with abnormal brain structure, abnormal brain activity patterns, and future risky or antisocial behavior. How can ADHD be treated? Extreme inattention, hyperactivity, and impulsivity can derail social, academic, and work achievements. The symptoms can be treated with stimulant medication, behavior therapy, and aerobic exercise. Debate continues over whether normal high energy is too often diagnosed as a psychiatric disorder and whether there's a cost to the long-term use of stimulant drugs in treating ADHD. Do disorders increase risk of violence? So, no, most violent criminals are not mentally ill, and most mentally ill people are not violent. Few people with disorders who commit violent acts tend to be either those who experience threatening delusions and hallucinated voices that command them to act, who have suffered a financial crisis or lost relationship, or who abuse substances. AP exam tip, note that the term insanity comes out of the legal system. Insanity in criminal law means that defendants cannot be held accountable for their actions at the time of the crime, typically due to mental disorder. It is not a psychological or mental diagnosis and does not appear in the DSM-5. How many people have or have had a psychological disorder? The U.S. National Institute of Mental Health has estimated that just under 1 in 5 adult Americans currently have a mental, behavioral, or emotional disorder, excluding developmental and substance abuse disorders, or have had one within the past year. What disorders are most prevalent in America? Depressive disorders or bipolar disorder is the highest, followed by phobia of specific object or situation, followed by social anxiety disorder, followed by ADHD, post-traumatic stress disorder, PTSD, followed by generalized anxiety, schizophrenia, and OCD. And that's as of 2015. How prevalent are disorders across the globe? A World Health Organization study based on 90-minute interviews with thousands of people who were representative of their country's population estimated the number of prior year mental disorders in 28 countries. The United States is by far the highest. And then you can look down the list: Ukraine, Colombia, New Zealand, France, Lebanon, all the way down to Japan, China, Nigeria as being the lowest out of those 28 countries. And if you look at the bar graph, it also has the lines. That's the proportion of those disorders that are considered serious. What are risk factors for mental illness? One example of a risk factor for a psychological disorder, poverty, crosses ethnic and gender lines. The incidence of serious psychological disorders is 2.5 times higher among those below the poverty line. Other risk factors are listed along the right-hand side, so pause it and read over these. And these are in alphabetical order, not any other order than that on the right side. What are protective factors for mental illness? There are many factors that can help shield people against mental illness. The protective factors that we're looking at now: aerobic exercise, community offering empowerment, opportunity, and security, economic independence, effective parenting, feelings of mastery and control, feelings of security, high self-esteem, literacy, etc., etc. So many of those things are things that we really uphold in Montessori and that we're working so hard to ensure that you guys have the best experience possible. Does poverty cause disorders, or do disorders cause poverty? This is the last slide in our lesson. It's really both. The answer varies with the disorder. For example, schizophrenia leads to poverty, but other disorders may not. Yet the stresses and demoralization of poverty can also precipitate disorders, especially depression in women and substance abuse in men. So as we move through our unit, we're going to get really deep into different types of disorders. I do want to just go ahead and make another reminder that please do not let anything you learn make you feel like you have a disorder. If you are really feeling like something is up, then you need to reach out for support. But please don't let these lessons make you feel that way, and they are not to be used as any kind of diagnosis. Thank you guys. Have a great day or night.